My name is Michelle Tace. I'm an occupational therapist. I work in a skilled nursing facility in Sayville, New York, and I've been practicing for about 2.5 years.
What are the most common causes for falls?
Two most common causes of falls that I see with my patients, the geriatric population, is impaired balance and poor safety awareness.
How do falls affect your life?
So, a fall will affect a person's life differently depending on your age and what population you're in. For myself, I fall, I could get right back up. For a geriatric population, they have a fall, they could break a hip, break their arm, any bone in their body, it's really going to affect them. They need more assistance with their ADLs, they may need to relearn how to walk, their muscles atrophy, and they really need that extra rehabilitation just to recover from that one fall.
What are some tips to reduce the risk of falls outdoors?
So usually I'll tell my patients when they're starting to walk outdoors, we're going to start on the most even terrain outside, so either a sidewalk or the parking lot. After that, I'll say, okay, now let's find the easiest spot to get up on a curb, usually a ramp or a really low curb. After that, we'll figure out what sort of device is best for them to use outside. So either a cane or a walker or a rollator, whatever is best for them. And then following that, I'll see how they're performing. Usually with the older population, their biggest thing is being able to look in their environment, visually scan, and avoid any obstacles that may come their way. So cracks in the sidewalk, tree limbs that are down, anything like that, we'll try to avoid.
What are some tips for improving safety on stairs?
So I recently just had a patient who was getting ready for discharge back to his home. He lives in an apartment that has 14 stairs up with a handrail on one side. And he was independent with his ADLs. He was walking around with a walker. He was ready to go. It was just that last part that he had to get, and he was having a lot of difficulty. He also had foot drop. So we were trying to teach him the best way to get up the stairs, going up with your good leg first, followed by your bad leg, and he just wasn't getting it. He was getting up maybe 4 stairs at the most. Finally, we gave him our suggestion of going up the stairs sideways so that he could hold on to the banister with both of his hands. And he was really nervous at first. He said, no, guys, this isn't gonna work. I'm gonna be really off balance. We said, come on, just try it. So he tried it and it worked for him, and he was able to go home the next week. So what I usually say for patients who are trying to get up the stairs and they're having difficulty because of their balance, try a different way. Just because you've been doing one way your whole life doesn't mean it's the way you have to do it forever. You know, if you feel more safe and comfortable going up the stairs a different way, and it's going to help you in the long run, I say do it.
How should older adults approach uneven terrain?
So an assistive device is always going to add that extra point of balance. So figuring out which assistive device works best for you, either a cane or a walker. Obviously, a walker is going to give you more stability. So that's what we use mostly in the geriatric population. So the benefit of using any sort of assistive device is just always going to add that extra support. That way it decreases your risk for falls, it improves your balance, and it makes you safer in the long run.
What are the benefits of exercise?
So for every day you're in the hospital, or just even laying down and not getting up at all, you need at least 2 weeks of rehabilitation. So the less you use your muscles, the more weak they will become. So exercise is really going to help with maintaining your strength, and also if you were in the hospital, you weren't feeling well for a little while and you were just laying down, not doing anything, it's going to help you regain that strength back. And being able to maintain your strength and your balance is really going to help you prevent any future falls.
Do you believe that being physically fit can decrease the risk of falls?
Absolutely. I mean, even though you are considered part of the older population, doesn't mean that you can't stay physically active. And when I say physically active, I don't mean going to the gym and lifting weights and running on a treadmill. I mean going outside and taking a walk around the block. You'll see people in their 90s who are still able to do their laundry and cook their own meals. You'll also see people in their 90s who can't care for themselves and they're in a hospital bed. And I feel like the biggest difference is staying physically active. So just take the time, 15 minutes out of your day, just get up, take a walk around the block, or continue doing as much as you can for yourself, washing your dishes, doing your laundry, but being safe about it.
What are some examples of how to stay physically active?
For example, if you can't get up and take a walk around the block because it's not safe for you, sit in a chair, find a chair, do some chair yoga, do some arm exercises, some marching. You could do some kicks. You could pretend you're, in the Rockettes. Do anything. Just stay physically active as much as you can.